the trade association that represents primarily nonprofit long-term care providers across the spectrum. So we have nonprofit nursing homes, nonprofit assisted living residences, nonprofit senior housing, independent living providers, as well as adult daycare centers, which are primarily nonprofit, although there are some proprietary members.
You testified before a House committee on this new legislation that will change the culture of nursing home facilities in Rhode Island. Why did you feel this legislation was important, and what do you think are the key elements of the legislation that's good for Rhode Islanders?
Okay. I testified on behalf of our nonprofit nursing home members in support of a bill to bring what's called the greenhouse or small house model of nursing home care to Rhode Island. It's a new and innovative concept that just began in about 2003 in Tupelo, Mississippi, and is starting to spread throughout the country to provide more resident-centered care in a non-institutional-like environment. It basically takes the traditional nursing home setting of long corridors, a very institutional feel, to create a more home-like structure. And so it's seen as sort of the next advance in nursing home care. It's important because, one, it responds to consumer needs for a more home-like environment. People don't necessarily want the old institutional way of living of years ago. So it meets consumer preference, consumer needs. It provides for a higher quality of life and quality of care, and there's been some research that bears that out. We felt it was important to try and address the nursing home moratorium issue that has so far precluded bringing this new model of care to Rhode Island.
Tell us about that moratorium.
Okay.
What does it involve?
Sure. Rhode Island, like many states, implemented a moratorium on new nursing home beds in an attempt to control costs. The theory being that the more nursing homes that were built, the more incentive there would be to fill them, and the net result would be greater expense to state budgets through having to pay for many of these individuals. But what that's done is basically create an inventory of older nursing homes with this institutional feel. And so there are some homes that are interested in pursuing this greenhouse or small house model. They bumped up against this moratorium on new nursing home beds in their attempts to do so.
Now, when you talk about the greenhouse or small house concept, how does that differ from like what we hear talked about the Eden Care concept? Mm-hmm. Are they all uniquely different, or are they similar, or how are they the same and how are they different?
Okay. They're similar in their focus on resident-centered care, responding to individual needs of each nursing home resident. They're different in that there's sort of progressions along the trail of progress. In fact, the person who invented what's trademarked the greenhouse model is the same person who developed the Eden alternative. And so he saw the greenhouse as the next iteration in long-term care. And so their similarities are this culture change, this shift from an institutional approach in both setting and care towards a more individualized approach. The difference is greenhouse is much more of an environmental change as well, where it's individual rooms with a more home-like living area. The residents can actually partake in food preparation, for example. And so it's basically taking the next step after the Eden alternative.
You know, baby boomers now are retiring. Many already have. Soon they and their families will be facing decisions on their health care as they grow older. I would think that the nursing home business, the demand, mm-hmm. At least for the short run, the next 10 or 25 years, I think that there will be a huge demand, because all these baby boomers are going to be coming of age when they might be good candidates for extended care or some kind of nursing home facility. Is that what you hear in your industry regarding projections?
Certainly, the demographics, there will be more demand for long-term care or long-term services. Where exactly they're received is another issue. So while there'll be more older people and presumably more people needing care, there's a growing number of options for people to receive such care. In the past, it was a nursing home and maybe some home and community-based alternatives. But Rhode Island, again, like many other states, is trying to increase the number of other alternatives such as in-home care, adult daycare, assisted living, and new models such as the PACE program and a few other housing with services type concepts that are coming to Rhode Island, to trying to increase those while always recognizing that there will be a need for some degree of skilled nursing care where people really need to have that 24/7 care that nursing homes can provide. So it's a balancing act, I guess.
When I talk to the sponsors of this legislation, as a person that's not in that business, it just seemed to be so obvious that it was a good idea. Because what we were talking about here is dignity, allowing our seniors to live in an environment that was safe for them and provided them the kind of skilled care that they would need from time to time. But it would allow them to live in a more home-like environment where they would bring some of their items from their own home and get rid of this kind of sterile, antiseptic hospital feel that you always had with nursing homes. I couldn't imagine anybody opposing this, but there was opposition to this concept.
There was, and I think it had to do with maybe some of the business-related aspects of the nursing home industry. Certainly, homes are undertaking a variety of culture change initiatives already to provide more consumer-centered care. There's, you noted, the Eden alternative, but homes, while not doing the Eden alternative per se, which again is a trademarked approach, are taking other steps for team-based care, resident-centered care, letting residents wake up when they want to instead of having to wake up at the same time. But some homes that had, as part of their mission to respond to the changing needs of elders and their family caregivers, for that matter, saw this new approach and wanted to pursue it. And it required them, in some cases, adding beds to the system. And so then the concern became, among other homes, about the effects it would have on their business. Because not all nursing homes are the same, and all nursing homes have different vacancies. Like we said before, some nursing homes are struggling with occupancy and some have waiting lists. So it really was a question of allowing those that had waiting lists and wanted to pursue this new initiative an opportunity to do so.
Do you happen to know how Rhode Island fares compared to other states in terms of vacancy rates in nursing homes now? Do you know like where we would fit on a grid nationally? Because I know some of those opponents said that it was going to oversaturate a market that already has too high a vacancy numbers with the available beds currently in Rhode Island. Do you have any research, or do you have any sense as to how Rhode Island compares to other states in the country?
I do not. No, I'm sorry. But our vacancy rate is about 90%, and it has dipped down a little bit. But that said, there's still many nursing homes that are full and have waiting lists. So it's just a balancing act. Really.
You said vacancy rate 90%. You mean occupancy rate?
Yeah, I'm sorry.
Yeah.
Scratch that.
Yeah, right. I was going to say that's really we probably won't use that anyways.
Okay.
This is kind of be the most important question.
Okay. There was one other concern I could mention too.
Okay, go ahead.
Another concern that was raised was cost concerns, going back to the idea that Medicaid is a primary funder of nursing home care in Rhode Island and elsewhere, and the idea that adding new beds would again add new costs. And so what this bill does is address that concern by, as nursing home beds, if they decline, should a few homes decertify their beds or go out of business, those beds then go into the pool for existing providers to use to develop this new model of care.
The, I guess, $64,000 question. How will this new legislation that's been approved in the Ocean State be good for Rhode Islanders? People that maybe have no need for this type of service now, but maybe will have in 10 years, 20 years, 30 years. How will this impact the quality of life of Rhode Island seniors?
It helps keep us at the forefront of this national trend towards new designs, new innovations in long-term care. It helps promote more consumer choice by having this option out there.